uh, we can see the recordings later. So good morning, good afternoon, good evening, good evening to all from lines from all over the world. Thank you for joining this session. We have today a very interesting person, Dr. Andrew from Malaysia, 308B1, and it will be an interesting session as far as I know him well. Uh, it has been fantastic. Within a month, our campaign has been doing fantastic numbers. We have already crossed 700,000 served with more than 89 districts participating. So it's a good number. And today we are going to release what we have is again our new thing for the campaign. Every month we are going to have one newsletter, which will it's not a big newsletter, it's a small newsletter, which will have some part of the campaign, some part that was interesting for that month. We will highlight that in the magazine. So I will show how it looks, and later on I will share the links for the newsletter. Just a minute. So, ladies and gentlemen, our first newsletter for the campaign, that is, we have named it the Lions Inspire. It's a very small newsletter. I'm just showing you the thing. So, what we are doing is every month, the speaker of the month, we are going to highlight them, what happened and who is the person. And also this year we have something called as the hybrid medical camp. A hybrid medical camp is again, one second, I need to mute everyone. Line Victor, can you mute everyone, please?
Yeah, I'll do.
Yeah. So what we have is something called as a hybrid medical camp, which is a new idea this year. So when a Lion Club is doing a physical diabetic camp, they can also conduct an online awareness camp. And ask people to do the test. So this is called as a hybrid. And what we have done is in July, we had more than 20 clubs doing the hybrid. So we have selected a few of the clubs and we have displayed them in the newsletter. So this will follow in the next months also. Whichever clubs have done and has given a photo which is usable, we will show them on the newsletters to motivate the club. Also, there are some do's and don'ts about the hybrid club, which is in the newsletter. You can read them, and I already published in the group. Also, our districts has been motivating the Lions in various forms. So one of them was giving the milestone certificates during one of the maybe a zone social or a region conference. So those photos, those who have sent me, we have put them in the newsletter. And I want to specifically mention about this one. This is very interesting. District 404B2, Nigeria, is actually made a banner patch for giving to the clubs who have served 250, 500 plus, and so on. This is really highly motivating for the clubs, and it will be like an everlasting memory because it will be there in the banner always. And yesterday we celebrated Happy Youth Day, and there's some information and about the achievements for the July's, the top 10 in the 8 matrices. We have mentioned them in this thing in the newsletter, as well as we have ambassadors of the month based on this 8 matrices also has been highlighted. Next month, what we are going to do is we'll also have on this 8 matrices, the presidents who have done best, also we will try to highlight them in the newsletter. And our one of our advisor, line ID Mahesh Haskell, we have also mentioned them. Is line Geeta in? Geeta Prashant is in. Lion Victor is
Yes.
okay. Okay.
Yes.
So let's move to the next agenda. Lion Geeta, you can go ahead with the introduction of Dr. Andrew.
Windy.
Line.
It's windy. No.
Nagita is muted.
Okay. Actually, let's mute all and just unmute this thing. And where is Geeta Prashant? Okay, let me get her. Make her a co-host. That way, it's easy. Okay, Geeta Prashant, you can unmute yourself and yeah. Go ahead, Geeta.
Good afternoon. So today we have the honor of welcoming our speaker for this month's session, Dr. Andrew, who is the founder of the Clinic Xerox Southeast Asia's #1 Reversing Diabetes Center. Since 2017, they have helped more than 800 patients, especially diabetic patients, regain the freedom of health by removing their medications, insulin injections, and supplements. So please welcome Dr. Andrew, and let's hear from him why reverse diabetes and how. Dr. Andrew, the floor is yours.
Thank you, Geeta, and thank you, Vinod. So good day, everyone, all land dignitaries, lions, and ladies and gentlemen. Let me share screen first. Okay, so all right, and should I spotlight? Okay, if you can see me and you can hear my voice clearly, you can look at it. You can see the slides
everything is
clearly.
fine. Everything is fine.
Can you please comment C in the chat box right now, in the comment box? Yeah.
Yes.
So yeah. Please comment C in the chat box. Yes. So the way I conduct Zoom talks is there's a lot of interaction in the chat. Yes. So that this is to make sure everyone is awake for the next 30-40 minutes. Okay. Yeah. All right. Good. So without wasting too much time, we are going to proceed. Okay. So how many of you here wish you can take less medicine, insulin injections, or supplements? How many of you wish you can do that? It's either for yourself or for your family members. I don't know how many of you have family members who are actually a diabetic or hypertension, and you wish that they can take less medicine as well. Please comment the word yes in the chat box. Okay, so if you wish, yes, you or your family members can take less medicine, insulin, or supplements, please comment the word yes in the chat box. All right. Thank you, everyone. So we have the comments from Shubha. We have comments from Selvi, Angela, Jita, Kishore. All right, Lion Ravi, Damika, Vinod. Yes. Okay. Thank you, everyone. Yeah. So sometimes you must be wondering, right? Who in the world like to take medication, right? Yeah. So if you said yes, you came to the right place. All right. So as mentioned, I'm from Clinic Zero. I founded Clinic Zero, Southeast Asia #1 Reversing Diabetes Center, alongside with my sister, Dr. Jasmine. So since 2017, we have helped more than 800 diabetics to regain the freedom of health by removing, not prescribing, it's the reverse. We are removing the medications, the insulin, and the supplements. So we have patients coming from across the world, including Singapore, Indonesia, Malaysia, China, Taiwan, England, Scotland, as well as Australia. So if you're thinking, how are we able to see patients from across the world? It's because, all right, although we are located in Malaysia, our patients are all seeing us online. Okay, why is it online? Because diabetics are high-risk patients. I don't know how many of you are aware, right? Do you know that every 10 COVID-19 deaths, 7 are diabetic? How many of you at this point of time are rather shocked with these statistics? If you're shocked, please comment the word 7. 7 means that you just learned something new. 7 out of 10 diabetics, 10 COVID-19 deaths are actually diabetics? Yeah, please comment the word 7. Okay, if this is the very first time that you come across this piece of information. Yeah, wow, Lion Ravi actually said 8 out of 10. Yeah, probably in other parts of the world is even higher, but in Malaysia it's actually 7 out of 10. And I don't think it's too far away for other parts of the world as well. Okay, so thank you so much. All right, so we are seeing patients online. This is why our patients are coming from across the world. Okay, so let's watch a simple introductory video of myself before we proceed. At Clinic Zero, we believe reversing diabetes is possible. Hi, I'm Dr. Andrew. I help patients to reverse diabetes. By prescribing a low-carb, high-fat diet, we help patients to get rid of their medications, insulin injections, as well as supplements, so that they can regain the freedom of health.
Hi, I'm Dr. Jasmine. The reason I help people to reverse diabetes is because of in 2016, there was one patient who was admitted into the hospital, 40 years old Chinese gentleman, whereby he got a wound over the left shin. The wound was so deep that he required daily dressing and cleaning. In spite of him being very obedient, he took all his medication and injected insulin, but his sugar got higher and higher until the wound got very deep into the bone. That's why he required amputation after 2 weeks, in spite of me cleaning his wound every day. After that, he was unfortunate that he has to undergo the second operation, which was below the hip operation, and he got into a very severe infection where it took his life away. So he passed away within a month after his admission. That's why today I help my patient to reverse diabetes, because I know that the complications of diabetes is not reversible, but diabetes itself is reversible.
In 2013, I was misdiagnosed with a pancreatic cancer. They found a growth that is as big as a ping pong ball seated at the head of my pancreas. And without finding out what exactly it is, they offered me an operation. However, thank goodness, I insisted to find out what exactly is the growth, and therefore I escaped the 10 hours operation, because they later found out that it was actually a TB infection. These incidents taught me a very good lesson, and I told myself from then onwards, every time I see a patient, I must always look for the root cause. This is why today we help patients to reverse diabetes by focusing on the root cause of diabetes. The top 3 pain points of a diabetic patient is that, number 1, they have to take lifelong medications, insulin, or even supplements. Secondly, worst of all, despite taking all these medications, insulin or supplements, they still suffer from complications. Point number 3 is that when they suffer from complications, it's not just the money that they have to spend, but also the pain that they have to undergo alongside with their caretakers.
Our vision is to help 10,000 patients reverse diabetes by 2025.
Our mission is to use education to empower our patients so that they can reverse diabetes.
Currently, we have patients across 3 continents from the UK, Australia, Singapore, and Malaysia.
With the help of online consultation and a customized diet plan, our patients can see results as soon as 2 weeks. What if you can save up the money on medications as well as complications of diabetes and use the money for better purposes, such as better education for your kids or even traveling around the world? Let's go back to zero. Zero medicine, zero worry, and live life to the fullest. All right, ladies and gentlemen, can you share with us what is the one point that you pick up from the video so that we can go into the discussion? Please share with us what is the one point that you pick up from the introductory video so that we can have some discussion over the video. All right, so yeah, we'll be waiting for the answers now. All right, while waiting for the answers, I just want to share with everyone. The way I conduct Zoom talks is very interactive. So we always want to basically interact with y'all and have more engagement so that we really learn from each other. Okay. So Dana Bamford say avoid death. Yes, only when you reverse diabetes, you can reverse the complication and therefore avoiding death. Yes, Dr. Arjuwan say diabetes can be reversed by knowing the root cause. Exactly right. Yes, yeah. So understanding the root cause of diabetes is very important. And I want to share something with everyone today. Do you know that high blood sugar is only a symptom of diabetes and not the root cause? This is why when you take medications or insulin or supplements to manage your diabetes, you are only playing with the symptoms on the surface. You're not dealing with the root cause. That's why diabetes is not reversed most of the time. Okay. All right. So, okay. Thank you everyone for your answers, and let's proceed. Okay. So a bit of disclaimer first. The views and opinions presented are based on my own research and clinical experience. Please consult your own doctor before you make any changes to your medications or lifestyle. Diabetes mentioned in this workshop is type 2 diabetes. There is type 1, type 2, type 1.5, type 3 diabetes. Today, we only have time for type 2. If you're interested to know other types of diabetes, we can look into it at the end. All right. So today, we will share with you the top 3 secrets of diabetes and what are they. Number 1, can medications, insulin, and supplements prevent the complications of diabetes? Okay, so this is a secret that most people are not aware of, and today we'll find out. Number 2, what is the cause of diabetic complications? And number 3, is reversing diabetes possible? So these are the 3 secrets that we are going to review today. How many of you are ready to learn? Please comment the word 3 in the chat box. That means we know you are ready to learn these 3 secrets for today. Thank you, everyone. Okay, so one thing is we have to understand that diabetes is not just diabetes, but diabetes is also connected to obesity. And many a times, a lot of people thought, oh, if you're obese, you are big, okay, means that's a problem. If you're skinny, but you have a belly, you are fine. No, always remember, the central obesity, which is a belly, is more dangerous than someone who is actually big as a whole. Okay, so someone with a belly is most likely to have hypertension. Someone with hypertension is most likely to have fatty liver, and someone with fatty liver is most likely to have diabetes, and vice versa. They are all interconnected, and these are all with what we call metabolic diseases. All right. Okay. So so I'm Dr. Andrew, and I graduated from Manipur. I actually studied in India. Yeah, so I was there for 2.5 years. I love this country, and I wish I can go back again, of course, for tour. How many of you have heard of Manipur University before? If you have heard of it, please comment the word M in the chat box so that I know that I didn't come from some funny university. So this is where I graduated, and I not only I hold an MBBS, I also have a certification from Nutrition Network as a certified nutritionist, and I am into public speaking since since I'm 7 years old, because I believe this is the only way you can spread your knowledge, not just one-to-one, but one-to-many, like tonight. And I'm honored. Back in 2019, I was interviewed by one of the well-known TV station in Malaysia, which is Bernama TV. Okay, so I'm going to skip this part. So going to secret number 1. Okay. So yes, can we have Lion Vinod to launch this poll?
Yes.
We are going to have
Yeah.
a poll right now. Yes, the poll is, can medications, insulin, and supplements prevent the complications of diabetes? Okay, so please put your vote in. Is it a yes or no? Do you think by taking medications, insulin, or supplements, can it actually prevent the complications of diabetes? Is it a yes or no? Okay, the reason why I'm asking this is I noticed there are actually quite a number of doctors here as well. And I believe that when doctors prescribe this to the patients, this is what the doctors will actually share with the patients. Oh, please take this medication so that you can prevent the complications. But the question is it true or is it a false? Okay, let's find out. All right, so we have okay, 57%. Okay, we'll give another last 10 seconds before we close the poll. Let me know. Let's keep this for just 1 full minute and we'll close the poll.
All right.
Okay.
I'm ending the poll. Okay.
All right. Yes. Let's share the results so that everyone can see. Oh, okay. All right. Thank you so much. Let me know. Yeah. So we can see that the answers now. So 62% of you said that it can prevent the complications. Yeah, that means about 2/3. Another 1/3 actually say no. Okay, thank you everyone for participating in this poll. So we will stop sharing and let's check out whether is it a yes or a no. All right, This data may be a bit disturbing to some people, especially doctors. Okay, this is one warning I would like to give to all of you first. And if you are a medical doctor, one sincere request from me is please have an open mind to that tonight. All right. Okay. So let's check out this clinical study done by which is published in the New England Journal of Medicine. It was published in year 2008. We're looking for at a study that was done about 14 to 15 years ago. Okay, it's written here, effects of intensive glucose lowering in a type 2 diabetes patient. Let's check out. Okay, so we're going to go to this particular graph here. Let me see if I can draw. Yes, I can actually draw. Very good. Okay, so over here, this y-axis here is what we call glycated hemoglobin, means the 3 months average. I think last month our lion Lydia shared a lot about HbA1c, right? So this is HbA1c. Okay, so they split the patients into 2 groups. And it's a big group. We're talking about 10,000 diabetic patients in Canada and US. Check out. This is 5,000 and 5,000. Okay, it's 5,000 plus patients. The first group they put on standard therapy, means the standard dosage of medicine and insulin, and the HbA1c is not that awesome. It's quite high, 7.5. Can you see this line here? Okay, still quite high. Huh? While what happens to the second group is they added the medication. They increased the medication. They call it the intensive therapy. They increase the insulin level so that the sugar level is lower. Can you see? It's actually lower here, about 6.5%. So they actually achieve better sugar control. Let's find out what happened after that. This is the result. Death from any cause. Okay. Check out this line for intensive therapy. Do you realize that the line is actually on top of the standard therapy line? Yeah. How many of you are a little shocked with this study? If you're a little shocked, please comment the word S in the chat box right now that you are shocked by this study. We are not talking about a small little study here. These studies involve 10,000 diabetic patients, by the way. How many of you are rather shocked at this point of time when you actually see this result? Yes, thank you everyone. So the result is intensive treatment actually causes more deaths by a whopping 22%. And at this point of time, I do want you to trust what I say. And please don't trust the study as well, because it probably has got nothing to do with you, because those patients are already, they are from US, they're from Canada or something like that. Yeah. I want you to start thinking about the people around you or even yourself. Did you realize that despite taking medications, insulin or supplements, these people still suffer from complications? How many of you realize that this is happening actually? If you realize, please comment the word me in the chat box right now. If you agree with what I just said just now, whereby you saw people around you taking medications, insulin and supplements, and yet they still suffer from complications, please comment the word either yes or me. Means you know that yes, it's true. It is happening. It's not just that clinical study, all right, that was done in US and Canada involving 10,000 diabetic patients. Yeah. Okay. Don't you think this is very sad? Yeah. First of all, taking medications is already something that no one wants, right? But yet, after taking medications, the complications still happen. The question now is why? Why medications, insulin, and supplements causes more deaths instead of making their life better? What is the truth behind it? Okay. How many of you now, you're on your toes and you really want to know the answer? If you want to know an answer, please comment the word why, W-H-Y. Why? You see, especially as doctors, okay, and if you are patients, you want to know why. Because you are taking this for the rest of your life. You're putting your life at stake. Why? Now let me share with you the actual reason behind. Okay. Ladies and gentlemen, if you have rubbish in your kitchen, where are you going to throw the rubbish to? I'm going to give you 2 options now. Option number 1. You throw the rubbish, you pack it nicely, you throw it outside your house. This is option number 1. Option number 2, you are going to pack the rubbish and you say that, oh, it's so dangerous out there. I don't want to go out because of COVID. All right, let's throw it into my guest room. Let's say you have a guest room, empty, no guest is coming because of COVID or something like that. You're going to pick 1 or 2. Okay, if you're going to throw it outside, please comment the word outside. If you say no, I'm going to throw it inside my guest room, please comment the word inside. Don't worry, no penalization. It's your own house. You can do whatever you want to your house. You're going to throw the rubbish inside your house, please comment the word inside. If you're going to throw it outside, please comment the word outside. Okay, so we have Kishore, we have Angela, we have who else? We have, oh, answer is coming in fast. Good. All right, we have Christine, we have Selvi, we have Damika, we have Dana, Victor. Oh, we have Kavita who say inside. Wow, no worries. Yes, okay, good. Okay, Baba Yemi outside. Okay, Dr. Ajuwan outside. Okay, so I know what some of you are thinking now. Come on, Dr. Andrew, please don't ask stupid questions like this. It's damn stupid, right? If you realize that my question is stupid, you are about to find out how stupid it is for a type 2 diabetic patients to actually take medications and insulin as well as supplements. And some of you who are smiling, you probably already know the answer. Now, coming back to diabetes. Oh, someone is actually drawing on the slide.
Yeah,
Okay, anyway,
that's what
coming back
I'm
to
saying.
diabetes.
Let me try
Yeah.
to switch that off.
Yeah.
I thought I had switched that off.
Okay, all right. So well, no worries, it's not blocking the slide anyway. Okay. Okay, now come back to diabetes. Diabetes means you have too much sugar in your blood vessel, right? Okay, good. Your doctors start to prescribe medications to you, insulin to you. Those people who try to sell you supplement, they will sell you supplements. Okay, so now your sugar has successfully gone down. Please don't get me wrong. I am not denying the efficacy of medication. I'm a Western medical doctor myself. I have an MBBS. I'm a doctor myself. It is bringing down the sugar. It is definitely bringing down. Question, where has the sugar gone? Do you think it has gone out of the body, or the sugar is actually still within your body in a different compartment? Example, it has gone to your brain, causing a stroke. It has gone to your eyes, causing a blindness. It has gone to your heart, causing a heart attack. It has gone to your kidney, causing a kidney failure. It has gone to your legs, causing numbness. How many of you think that is actually still inside? Please comment the word inside now. If you think that the medications, insulin and supplements has successfully pushed the sugar into your body in a different compartment, please comment the word inside. If you think, no, this particular medicine is damn good one, it will push it outside, please comment the word outside. Do you think it's inside or outside? Yes, and we actually know the truth now. Yes, inside. The sugar never left the body. This is why when you see a diabetic, okay, who claim to have a well-controlled sugar level, they never escape from the complications. And this is a truth that most people are not aware of. Right? It's exactly like this picture. Any diabetics who is taking medication, I'm talking about type 2 here, by the way, not type 1, type 2 diabetics patient, they are actually intoxicating themselves when they are taking medications, insulin, or even supplements. All right. So this is secret number 1. How many of you have learned something today that you never thought it would come out from a doctor's mouth? Please comment the word 1. This is secret number 1, right? 1 in the chat box right now. If you think that you have really learned something so far, okay? All right. Thank you, everyone. Okay. So those of you who have commented 1 means you are still wide awake. Okay. Thank you so much. All right. So you see, in order to reverse your diabetes, you need to bring your weight down. Look at the patient. Okay. With a big belly, with no belly. Look at the HbA1c, 6.9% to 5.9%. Look at this couple, how they actually lose weight within about a year. Okay. So now let's move on to secret number 2. So we know that it cannot prevent the complications. Okay, so how does it actually cause complication? How does diabetes cause complication? So first of all, we have to understand that you notice that our blood vessel in the body is like a tree. Can you see the similarities in terms of the vessel, the size? So the further away from the heart, the tinier are the branches. You notice that? Okay, so it's just like this tree. The further away, the tinier it is. So remember, just now I mentioned the sugar causes narrowing of the blood vessel, right? It causes inflammation and narrows. During the narrowing process, the one that is the furthest away will get blocked first because they are the tiniest to begin with, right? Therefore, you notice there are a lot of diabetic patients, they suffer from numbness of the hands and the feet, right? Especially the feet. after about 5 years into the diagnosis. How many of you notice this pattern? Can you please comment the word numb, N-U-M-B, numb in the chat box right now? You realize a lot of diabetic patients suffer from numbness. Okay, they start off with this complication first. Please comment the word numb. All right, so I mentioned just now, wherever it gets blocked, it will cause problem. From stroke to blindness to heart attack to kidney failure to amputation. I'm not even talking about depression and all those yet, by the way. Yeah. Okay, so what is the cost? Of course, this study is from Malaysia, but we have it in USD as well. Yeah. So you can see the cost, the medical cost for all this, right? Look at this. Number one, myocardial infarction is a medical term for heart attack. Let's point to this. It says here, during the event year, let's say for a particular year, you suffer from heart attack, a diabetic suffer from heart attack. The cost is 14,000 USD. We're talking about, of course, the private sector, right? We are talking about the private sector. Yeah. It is written here 14,000. Ladies and gentlemen, I know many of you come from various countries. Can you share with me in your particular country, when somebody suffer from a heart attack, right? Usually what is the cost, the medical cost? Please share it with us in USD so that everyone can understand. We want a common currency here. Let's share in USD. Okay, because in my study, it's only 14,000, which I actually disagree with because I don't think it is that low. Okay, so we have Vinod who is actually in US now. I believe many of you here are from India, Philippines, and all sorts of countries. So share with us, okay, in your country, yep, how much is the cost of heart attack if someone were to suffer from heart attack? How much does it cost? What is the medical cost? Yes, can someone share with us? Yeah, so that we can discuss, so that we know that whether this figure is actually right or wrong. Maybe Vinod, you want to share with us as well in the chat box. How much does it cost in the US? I think US medical, medical cost is pretty high, right? If I'm not. Okay, so Rajiv say 0.1 million means we are talking about 100,000, 1 lakh, right? Yeah, 100,000 USD, okay, per operation for one heart attack. So you notice, okay, so now we have the answer from Rajiv. Thank you so much for your participation. Just look at this one example itself. It's 100,000, it's 1 lakh, 1 lakh, right? Did I get it wrong? Sorry, Vinod, did I get it wrong? Because I left India for some time, I've forgotten. It's 100,000, 1 lakh. Okay. Okay, Kavita say more than 10 lakh Indian currency. You notice that the figure is really, really high. It's not the small little figure that is written here. So you see, complications are very, very costly. All right, complications are very, very costly. Yeah, and the total here, if you were to put in all the complications like heart attack, a stroke, a heart failure, okay, ischemic heart disease is a milder form of heart attack. Amputation is not even free. You have to pay for amputation. You need to pay the doctors to chop off your legs. Do you know that? How cruel can be, right, doctors? Yeah, blindness, yeah, it costs you 1,008. Kidney failure, right? You know, we know that, you know, lions also are involved in hemodialysis to a certain extent. 32,000 US dollar per year, and it never ends until the patient dies, right? And even diabetic foot ulcer. The total cost here, if I just want to round up, even for this figure, it will come out to almost 67,000 per year. So you know that the complications is very, very costly. And how many of you agree that this can be a disaster, not just for the person, for the diabetic patients themselves, but also for the family members, as well as for the country? Yeah, how many of you agree with me that this is a huge economic impact? All right, this complication is a huge economic impact. If you agree, please comment the word yes in the chat box right now. Yeah, so I always ask my patients, you know that as a diabetic, you have to spend this money no matter how, right? Would you spend on complications, or would you spend on reversing your diabetes? And I don't know how many will agree that reversing diabetes will always be cheaper than spending on complications. Do you agree with me on this? If you agree, please comment the word reverse in the chat box right now. Okay, thank you so much for those of you who participated and answered yes. All right, yeah. So coming back to secret, so going to secret number 3. While I keep saying reversing, can it be reversed? Am I the first doctor in the whole world to say that diabetes is reversible? No, not really. I also learned from somebody. Yeah. But let's move on to the second poll and see how is it like. Okay. Can we have let me know. Can you please launch the next poll?
I'm going to share the second poll.
Yes.
Please answer yes or no based on, yeah, go ahead.
Okay, the reason we're asking this is if you go based on the standard guidelines of managing diabetes, most doctors will say no. Yeah, including myself. All right, when I learn from my seniors, when I learn in medical school, it is always a no. All right, it is always a sad case where patients have to take medication, insulin, or even supplements for the rest of their life. But is that true? Is that really so? Okay, we're going to find out today. All right. So yeah, 3 more seconds and we will wrap this up. Okay, 1 minute is up. So let's end this poll and let me know. Can you help me to share the results? Yes. So at this point of time, about 1/3 of you, 38% say yes, a diabetic can actually stop. Okay, by the way, we are talking about type 2. We're talking about type 2. Yeah. And then about 62% of you say no. All right, thank you so much for your participation. Let's move on. So how did I get inspired? Many of you know that I was wrongly diagnosed with a pancreatic cancer. Okay, and that's when I told myself, I need to look into the root cause when I treat any patients for that matter, including diabetes. So one of the first doctors to inspire me is Dr. Sarah Hobart from the US. She just passed away a few months ago due to lung cancer. All right, she started this thing called Virta Health in the US, where they are doing a lot of study on reversal, diabetes reversal, and so far they're very successful. I watched her TED Talk, okay, TEDx, TED Talk on YouTube back in about 2014 or 2015, which inspired me to do what I do today. She actually started the journey for me, and I am very thankful to her. Too bad, of course, I couldn't thank her in person anymore because she already passed away. The next person who inspired me is Dr. Jason Fong. Okay, I need all, especially if you are doctors here, please take note on these two doctors. Okay, I hope you can just note down their name. Okay, yeah, we are only Southeast Asian #1. We are not world's #1, but I consider Dr. Sarah Hobart and Dr. Jason Fong world's #1 when it comes to reversing diabetes. Check out their videos, their Facebook posts and everything, and you'll be surprised by the number of lives they have changed by helping patients to reverse diabetes. So Dr. Jason Fong is a nephrologist, a kidney specialist. So you must be thinking, why is a kidney specialist doing in reversing diabetes, right? Yeah, for information, kidney specialists make tons of money. Yeah, because they just make tons of money. So Dr. Jason Fong, if his intention is to make money, he doesn't have to focus so much on reversing diabetes. But why is he doing that? As a nephrologist, kidney specialist, he saw too many kidney failure patients too late. By the time they saw him, there's nothing he can do. And he was like, how come all these patients are taking medicine, insulin, but they still can't prevent this complication? That's how he looked into it, and he has written many books. Diabetes Code, Obesity Code, Cancer Code, book on fasting. All these are the books he has written. All right, and myself, I know him, but of course he doesn't know me because I'm not famous enough. But one day I hope I can thank him in person. Okay, so I will play one video one testimonial video of my patient, and then we will proceed with Q&A after this.
Sometimes in around that month of January, I was almost pre-diabetic. And I'm Selvi. I'm 49 years old this year. In January 2021, I was 95 kilo. So that was really very stressful for me because I was not obese as a child. I was always very slim, about 50 something. So we were doing a lot of exercises at home. I will come down, but the moment I go up to where more than what I was. So, it really makes me feel like I want to quit, I don't want to do exercise, let me just be big, because it's so painful to do exercise. And there was, I think sometimes in around that month of January, I was almost pre-diabetic, and I was on blood pressure tablet for 10 years. So I know that, there's no reversing from there. So it's going to only get worse. It's not going to get any better. So that's the time I was looking out who can give me some, some information or assistance or, guidance on how I can lose my weight without giving me boxes of tablets. And we were like, what do we do next? What kind of supplements do we take without, spoiling our health, all these things. Then we actually watched Dr. Andrew's program for about, I think, came to about 1.5 or 2 hours.
2 hours,
Yeah.
about 2 hours.
We actually learned a lot from there. What really made us surprised and shocked at that moment was we could actually reverse diabetes, which for me personally, I didn't know you can actually reverse diabetes.
Yeah.
That really opened up our eyes to all this information. Okay, I feel extremely happy and very grateful to Dr. Andrew because I've actually managed to lose about 31 kilos in 1 year. And after coming into this program, I've actually stopped my blood pressure tablet for about, now it's coming to about 8 months. 8 months, and my last visit to the GP, my GP said my blood pressure is excellent at 120/82, and I've never had this kind of reading before. And I've actually completely changed my clothing size from XXL to now I can fit into M and S. The other thing is my shoe size has already reduced to 1 size smaller because of no more swelling. Yeah, I just want to say one thing. When I first started this program, just like everyone else, I was very hesitant. And when I spoke to Dr. Andrew, he told me this. He said, Selvi, he told me I can actually lose my weight. So I asked him, Doctor, really can or not? I've already tried so much, cannot. So doctor said, Selvi, you don't believe in yourself, you please believe me. I will show you the change. And that's what happened now, 31 kilos. Yeah, reversing diabetes is possible. Bringing down your weight is also more possible. Yeah.
On a side note,
All right. So this is it. Diabetes is reversible. And I will spend the next 1 to 2 minutes to explain what does it mean by reversing diabetes. There are 2 criteria when it comes to reversing. Okay. Criteria number 1, your blood sugar, your blood pressure, and your body weight, okay, means your BMI, your body mass index, must be within the normal range. This is the first criteria. Okay, I repeat, first criteria, your blood sugar, blood pressure, and also your body weight, that means your body mass index, must be within the normal range. This is criteria number 1. Criteria number 2 is that it has to be done without using any medications, insulin injections, or supplements. That is the second criteria. Okay, how many of you realize that, wow, these 2 criteria means is reversing diabetes, and this is probably something that a lot of people actually want it, especially if you are diabetic. This is something that a lot of people actually want it. Please comment the word 3, because this is secret number 3 now. Yeah, if you think that what I just shared is something that a lot of patients probably want to go for it, they want to reverse their condition, they don't want to depend on any medications, insulin, or supplements. Right? Yes, thank you everyone. Okay, so we are going to Q&A session now. So I'll pass the time back to Vinod for him to basically handle.
Thank you, Dr. Andrew. This is a very wonderful session by you. And let's open up any question and answer sessions. Anybody have a question, please raise your hand and then I will allow you to unmute yourself.
By the way, those of you who are shy, you may also type in the chat box. I will also pick up the question from the chat box. Yeah, we have two hands raised. Yeah.
Yeah, okay. Yeah, go ahead. Line Kavita Yadav. Please.
Yes. Sir, good evening.
Good evening.
I myself, as a person, I am weight about 80 kgs and I'm pre-diabetic from last 2.5 years. So as of now,
sorry, can you speak louder? It's very soft on. I can't hear.
Can you hear me, sir? Is it audible?
Can you speak closer to the mic because it's a bit soft?
Yes, sir. Are you able to hear me?
Just on for what I think something is not right from my side.
Actually, we can hear Dr. Andrew. Something is wrong on your.
I think it's my side. Yeah.
Yes,
Okay.
yes.
Okay. Can you try again now?
Yes, sir. Sir,
Okay.
I
This is better now.
myself, yes, I myself, I'm aged about 47,
Yes.
and I'm not using any medicine for diabetic. As such, recently, about a month back, I am on what you call hypertension medication. Just recently, I started. With I'm not able, as I'm profession by an advocate. I have lot of work of sitting instead of moving. So they say there is increase in my weight, and automatically I am a hypertension, and I have to take it. Otherwise, I'll be diabetic. So I have not yet entered into diabetic, but I am pre-diabetic. I am not on any medication. So is there any chance for me to have this reversible?
Okay. Thank you so
Yes.
much for the questions. I think many of you can probably relate to this statement. The longest diabetes I have successfully reversed is 38 years. That means the patient has been a diabetic for 38 years. As old as me, I'm 38 years. I'm 38 years old this year. So the patient has got a diabetes since 1984, and we successfully reverse it as well. So it can be reversed. But did you notice a pattern that was presented just now? Okay, sorry. Because just now there were too many. Who was the one that was asking a question again? I'm so sorry. We not.
Next question is Dr. Jaiprakash
No.
Chavan.
Who was the person who is asking the question just now?
That was line Kavita, I think, right?
Kavita. Okay. I want to highlight a point that was presented earlier on. You remember when I shared a slide on metabolic diseases? So do you realize hypertension, diabetes, and obesity, they all come together? When you have one, you have another one. So if you do not reverse your hypertension and you do not bring down your weight correctly, your pre-diabetes will definitely move on to diabetes. This is 100% sure. And if you're thinking that it's because of your lack of exercise, you are having this problem, I'm so sorry, I have a bad news to share with you. It has got nothing to do with exercise. Nothing. Exercise makes you fat. You cannot keep fit by doing exercise. You cannot burn away the belly fats by doing exercise. And you trust me, you cannot reverse your hypertension, your pre-diabetes by exercising. It's a wrong method. The correct method is to go into the correct diet. It's never about exercise. Yeah. Okay, let's move on.
Next one is Dr. Jaiprakash Chavan.
Yes.
Go ahead, sir.
Hello, sir. Dr. Andrews.
Hi, Dr. Jain.
Sir, your advice to not do to exercise. Why?
Okay, I'm not advising you not to do exercise, but I'm saying that if you're just using exercise, it doesn't work. It is actually from diet. Okay, let's go into a simple question. How many of you notice there are people around you, right, who have been exercising for the past 10, 20, 30 years, right? But they still have a belly. They still got diabetes, they still got hypertension. How many of you realize this particular pattern? Please comment the word 3 in the chat box right now. 3. 3 means they still have a belly, they still have diabetes, they still have hypertension. Now the question is why? Why exercise alone cannot help these patients? You see, there are a lot of people, a lot of you who answered 3. So it's not just Malaysia alone facing this problem. It's throughout the whole world facing the same problem, right? Why? Because, ladies and gentlemen, what happens to you after you exercise? How many of you can tell me what happens to us after we exercise? What happens to us? I'm giving you a bit of hint now. Can you put in the chat box, what happens to all of us after we have exercise? After we exercise, what happens to us? Can someone share with me in the chat box right now? It's just one word, which will give you the answer really. Yes, correct. Thank you so much, Baba. You are hungry. When we are hungry, we end up eating. Do you think we end up eating more or less calories compared to what we have burned? If you think we end up eating more, please comment the word more. If you think no lah, I very good one. After exercise, right, I take very little food only. Then you put the word less. Do you think you end up taking more calories or less calories after your meals? Okay, especially after your exercise. Correct. You end up eating more and you can't control it because your body craves for it. This is why exercise makes you fat. I do not say for the sake of saying, I'm saying based on science. Yeah, many of you already know this. If you have been trying using exercise to reverse your condition, I'm so sorry, you can stop trying already. Yeah, I'm giving you a shortcut now to tell you straight off, you can stop trying because you're not going to succeed. Okay, all right. Thank you so much. Let's move on. Next question. Is it Tilini, sorry.
Yeah, yeah.
Thank you, sir. Thank you. Thank you.
Hi, yes. Welcome.
Yeah.
Thank you.
Go
thank
ahead. Go ahead, line Tilini. Unmute yourself, please. Line Tilini, please. I can't unmute her. What happened? We'll take the next question. Dr. Padmavati. I'm not able to unmute. Okay. Dr. Padmavati, you can try unmuting.
Hello, can you hear me?
Yes.
Yes.
Doctor, there are two questions for me. One is, you said reversal of diabetes when you reduce your weight. I completely agree with you because I'm a living example. But what about lean diabetics? What does the role of reducing weight come into play? Only in obese people, if you reduce the weight, diabetes can be reversible. Second point is, I disagree with you that exercise will not reduce. Whether you exercise or do not exercise, the main point is the number of calories you take as per your BMR, how much your body works out. So when you eat more, you have to exercise above your calories. If you are within your calories, you don't need to exercise. So these are all interrelated. This is my personal experience. That's how I control my diabetes in this. So I come out of my drugs and again into my drugs. And then when I exercise, because I'm obese, I eat a lot because I'm a good dessert eater. So these are all the personal experiences. Being a doctor, I know. But you are saying that exercise is not needed. Exercise is not needed when they are within the caloric limit and the sugar intake is less. And what about lean diabetes people, where how much more weight can they reduce? Then how will you reverse the diabetes?
Okay, thank you for the question. Yeah, this is a technical question here. We have helped more than 800 diabetics so far. This is based on our experience with more than 800 patients. Between someone who is obese and a normal weight diabetic, that means lean diabetic, right? The lean diabetic one is the tougher one. It's the tougher one to reverse, but it can still be done. Most of the time, it can still be done. Our success rate is up to 80%. We have a success rate of reversing diabetes of up to 80%. That means it can still be done. Because many of the lean diabetics, although they are lean, right, they still have central obesity. They still have a belly, which means they have fatty liver, which means they have insulin resistance. So most of the time for these people, we will still proceed with the methodology of doing low carb, high fat diet as well as intermittent fasting. All right. And their progress will actually be a tougher one because we have to balance between their weight. We have some patients who are also underweight. Okay. So for underweight, we would ask them to do muscle building exercise to build back their weight. But at the same time, we want to bring down their sugar. So it can be done. It is more complicated. We always inform this to the patient whenever they come on board to our program. Yeah, so but it can still be done. Okay, so this is number one. Number two, when it comes to exercise, okay, exercise for most people who don't know how to control the diet, right, it doesn't work. You see, just now when we mentioned in the chat box, you already saw a lot of responses coming back. We eat more after we exercise. Yeah, but if you know what to do with your diet, okay, then you do exercise and you know how to do it with your diet, exercise will help. Exercise cannot lose weight, but exercise can help to lower your blood sugar and your blood pressure, but it cannot help you to lose weight. You have to use diet. Okay, so in my experience, out of 100% in your lifestyle, 100%, 80% depends on your diet. 20% depends on exercise. So for our patients, even if they don't exercise at all, we don't really push for it, but we want them to make sure they follow the diet very strictly that we prescribe to them. Then we can actually switch off their medications. And someone mentioned that just now in the chat box, someone mentioned that they successfully reversed, but because the weight came up back, the diabetes came back. It's true. Okay, weight, this body weight, blood sugar, and blood pressure, they're all interconnected. When one is up, the other two will also shoot up. So that's why no matter how, we have to maintain this our body weight BMI index, yeah, according to the region of the world. All right. Yes, Tanuja, you're right. We are what we eat. It's true. Yeah.
Dr. Andrew, what we can do is we can after the closing remarks and vote of thanks, we can if anybody have more questions, we can definitely answer them.
Yeah,
so
we can do that. Yeah.
Yeah, that way we can keep the timing agenda, and we can keep the floor open for some more time after the vote of thanks. So let's hear from our MCC Lion Anura from Sri Lanka. He's been, we are very honored to have you, sir. So let's hear from him. And Sri Lanka this year, we are so lucky. We have 6 districts from Sri Lanka, and all of them are participating in this year's campaign. So go ahead, sir.
Right. Good evening and good morning to all of you. So thank you very much for inviting me to view the vote of closing remarks. This is the first time that I thank you, Dr. Andrew. This is the first time that I heard that diabetes, type 2 diabetes is reversible. I'm also a person who is on drugs, but today you made something to think about and to follow a new path. So yes, if the diabetes, type 2 diabetes could be controlled by the drugs, then most of the people would have been in a good in health condition. But I think now this is your opinion, and your research was a new beginning for us. And I think until 1925, when Helen Keller addressed our international convention, she eye-opened us to be the knights of the blindness, of reversible blindness. So today, same thing, we have Dr. Andrew, and he invites us to think that type 2 diabetes be reversed, and we can have our normal day-to-day life. So it is now with the questions raised at the question and answer time. Now there is some pros and cons about these exercises, but Doctor explained that 80% depends on the diet and 20% is exercise. The thing is, now we are doing thorough exercises, and as Doctor mentioned, after the exercise we eat something more or something like that, and again we are having more sugar in our bloodstream. So anyway, now I think this is a new thinking for the Lions also. There is we have a famous thought that where there is a need, there is a lion. So for this century, Lions Clubs International selected 5 global causes. In that 5, number 1 is diabetes. So we have to think about that, and the statistics are very alarmable. How it says now 463 million are suffering from type 2 diabetes, and they estimate that it will go up to 650 million. And the thing is, 1 person out of 11 is suffering from diabetes, and 1 from 2 is undiagnosed. And the alarming thing is 1.5 million children are under this diabetes, type 2 diabetes. So as Lions, what we gain from the doctor is our attitudes and our behavior towards the food, right? I think, and with that attitude, we can reduce our intake of sugar. And with some sort of exercises, so we can maintain our body mass and the blood sugar level and the blood pressure level. So I think that with that, we can have a better life than we are suffering today. So as Lions, what we want to do, what I request from you all, please go to the society and educate people, educate about this message, rather than depend on the medicine or supplements. Educate them to have change their dietary pattern and stay healthy life, and without medicine and supplements, we have a good life. So I think it is my pleasure to have participate in this program, and I think you are doing very well. So the organizing committee and the participants, thank you very much for your participation. Without your participation, this won't be a successful one. So thank you once again, the organizers, and thank you very much, Dr. Andrew, for eye opener of all of us. So my humble request is to Lions, please educate the general public, and we try to make this world for a better place for those who are suffering from type 2 diabetes. Thank you very much for giving me this opportunity.
Thank you very much, MCC Lion Anura, for the wonderful closing remarks. And let's move on to the next agenda. Lion Emmanuel Foster from Ghana will give the vote of thanks.
Good afternoon. Can you hear me?
Yeah, go ahead.
Yes, good afternoon, fellow Lions and non-Lions. I would like to use this opportunity to thank each and everyone who have taken time to attend today's session. In fact, I have learned so much on diabetes. I never knew it was just like this, but I have taken time to listen to Dr. Andrew. Thank you very much. And thank you to everyone who have taken time to attend today's session. I hope we have learned so much. And on behalf of the core team and the organizers,
Lion Okafor has a little bit network issue that was mentioned. So I think we lost him. So anyway, I'll continue the thank you for attending, and thank you, Dr. Andrew, for this wonderful eye opener, because definitely we have learned a lot from you today, and your style of presenting has been fabulous, and you have kept our audience well engaged. I really enjoyed that session. And I thank all the people, all the Lions from all over the world who have come here and made this event a success, and especially MCC Anura for giving your time and giving your closing remarks. It was definitely like Dr. Andrew said, diabetes can be reversed, and I also feel like the same thing. You know, you go to a gym, you do exercise, you come back. If you eat garbage, you will get garbage out, basically. So definitely exercise is good, but you have to also control your diet also. That is 100% correct. So with that, I think we are done. And now we are open for any questions. Now you can ask. You raise your hand. I think Lion Tilini still has the hand up. You can ask the question. Lion Tilini. If anybody else have a question, please raise your hand and you can ask the question.
And our MD 321 diabetes chairperson, PDG Kishore Verma sir is here.
Okay.
Please welcome him for some words.
Oh yeah. Okay.
Yes,
okay.
I can see him.
Yeah, PDG Kishore, if you have any comments, please, we'd like to hear He's MD DC diabetes from MD 321. He's in California, and it's only 6 o'clock for him.
So, sir, are you there?
Let me try to unmute him 1 second. I am not able to see him. Anybody else want to have any question? Okay, I have line Victor.
Yeah.
Go ahead, line Victor.
Actually, I asked this question on the chat box. I think some doctors ask us to skip the breakfast. I mean, after the dinner, to skip the breakfast and fast till about 11 o'clock. Is it advisable?
Okay, this is a very good question. Breakfast is the most important meal to skip. I repeat, breakfast is the most important meal to skip. One of the methods to reverse diabetes, hypertension, and if you want to lose your belly fats, right? One of the most effective method is to skip breakfast. So a good timing for you to start eating is correct. It's 11 a.m. to about 12 p.m. That is a good timing. It's very easy for you to skip breakfast actually. And it's important to skip breakfast. The reason why so many of us have diabetes now, why so many of us are fat, why so many of us have hypertension is because we take breakfast. Taking breakfast is plain wrong. I give you one example. Do you know that we have 800 over patients? I want you to pick a guess. Okay, we ask them to do fasting sugar in the morning and also 2 hours after dinner blood sugar. Okay, which one do you think is higher? The fasting sugar in the morning, or is it 2 hours after dinner? If you think number 1 is higher, please comment 1 in the chat box. If you think no, the 2 hours after dinner sugar is higher, please comment 2 in the chat box right now. Which one do you think is higher? Is it the first one or the second one? The morning sugar is higher after you fasted for the whole night, or the second one is higher, 2 hours after dinner? Which one do you think is higher? Yeah, well, most of you here answered 2. There's a few ones here. Okay, you want to know the truth? The truth is 1. The fasting sugar is higher. And please don't trust me on what I say. I don't like people to trust me. I want you to trust yourself. I'm going to ask you a few questions and you will understand why I do so. Ladies and gentlemen, is it easy to feed kids breakfast or not? Is it easy to feed kids breakfast? If you say yes, you think, oh yeah, my kids love to eat breakfast, please comment yes. You say no, it's very tough to feed kids breakfast, please comment the word no. That means it's not easy to feed kids breakfast. Is it a yes or no? Is it easy to feed kids breakfast or is it difficult to feed kids breakfast? We have people coming from all over the world now, so it's not going to be like, oh, only Indian kids love breakfast. Malaysian kids, they don't like breakfast. No, okay, so you notice, there's a lot of no here coming in now. My next question to you now is why? If breakfast is so important, like what is being published by, advertised by so many people, right? Especially all those companies that sell oats and all this. Why kids have no appetite? What is the scientific reason behind? Ladies and gentlemen, it's called the dawn phenomenon. Do you know that this dawn, D-A-W-N phenomenon happens in every one of us between 5 a.m. to 8 a.m. in the morning, these 3 hours. What happens during these 3 hours? The stress hormone is released from the brain and a lot of sugar is released from your liver. It will suppress your appetite because your body doesn't want you to waste time taking breakfast, spending time to prepare breakfast. It will suppress your appetite. It will release enough sugar for you to last until, like what Victor says just now, 11 a.m. That's why you realize that over the weekend, when you don't wake up early, all right, you notice that when you always go for brunch at about 11 to 12, that's when the hunger pang actually sets in. Because by then, the sugar that is released in the morning are all used up already. So one of the methods for you to get rid of your belly, for you to reverse diabetes and reverse hypertension, skip breakfast. The scientific term for this is called intermittent fasting. Today, I've only shared on why reverse diabetes. I did not share on how to reverse diabetes. I don't know how many of you are interested. If you're interested, I can always have another session where I actually share with you the scientific way of reversing it. But it's a bit dangerous if you have medication because you are not monitored by a doctor. Yeah, because if you follow exactly step by step, when I present on how to reverse diabetes, you will actually go into ICU because your blood sugar will drop like crazy. You need a doctor to monitor and to get rid of your medication one by one. Okay, thank you, Victor.
Thank you, doctors.
We have Dr. Jaiprakash Chavan asking you a question. Go ahead, Dr. Jaiprakash.
Yes, sir. Sir, I am asking for the how reverse the diabetes. What is the way?
It's a diet plan. Which I just mentioned that I need at least another one session. Do you realize that in the last video I shared just now, my patient who came on board into my program watched my talk for 2 hours, and today our Lion Vinod is very stingy. He only gave me half an hour. Can you imagine? I squeezed all the 2 hours content into half an hour. So yeah, we definitely need another session.
That in
really
between,
want
what we can do in between.
What you can try to do now.
Our campaign must be going on.
Yeah, your campaign can go on, no problem. That's not an issue. The online campaign all can go on. That one is not a problem at all.
The
Yeah.
questions must be revised.
Question must be revised. No, the next question is already based on our talk tonight. The next set of quiz is based on the question, based on the presentation tonight.
You know, sir.
Yeah. No, what I guess, like Dr. Andrew already has given one secret out, basically saying skip the breakfast and eat breakfast around 11 o'clock. Try it out and see after 2 weeks we can see if no wait we can catch Dr. Andrew, and I know where he lives, so we can go to Malaysia and catch him.
Vinod, I think what doctor is telling is correct because I am doing that. I am skipping my breakfast.
Yeah, so we have a live testimonial here.
Yeah, the thing is, see, I go to gym around 9:15 a.m. in the morning, and to go to the gym, you need some energy, right? So I can't skip breakfast for that, I have to eat and then go to the gym. Otherwise, I can't lift my weights.
I disagree with you on this. Okay, I disagree. I am an avid hiker. I'm very crazy about sports. Yeah, I'm a crazy fella on when it comes to sports. You know, right? You saw my Facebook. You know, I'm always in the jungle. Okay? I'm in the jungle more than I'm in town. Okay.
Yeah.
Do you know that I always go for exercise with an empty stomach? I always do that. Even when I go for 20, 30 kilometers hike, I go in with empty stomach. Okay. Everybody thought they must eat in order to have energy, right? This is what everybody say, right? Oh, I must eat. Then only have the energy to exercise, right? Okay, let me ask you a question now. What happens?
What is about medicine, sir? What is about medicine? We continue or not?
No, when you continue all your medication, you continue what you're eating now because the medication can only be removed under one-on-one consultation because everyone is different. I cannot just say, oh, you know what, you can switch off my medication today. No, you can't. Oh, I can switch off my insulin today because after I hear Dr. Andrew from Malaysia who actually spoke that, you can, provided you are under a doctor's guidance. Not any ordinary doctor, a doctor who knows how to reverse your condition because it has to be monitored very closely. Otherwise, you will get into trouble. Okay, sorry, Dr. Jai, let me continue with what I was talking about for VNOT. Okay, this is something that most of you might be taken aback as well. Okay, you see why I say you should exercise with an empty stomach. Okay, simple. What happens to us after we eat? How many of you agree that we are tired after we eat? Please comment the word tired in the chat box. If you think, no, I'm super energetic after I eat, please comment the word energetic in the chat box right now. Do you feel tired after you eat? Please comment the word tired. If you say, no, I'm super energetic, please comment the word energetic in the chat box. Do you feel tired or do you feel energetic? You're very naughty. Too bad the majority wins. They are more tired now. Okay. Do you know why you are tired? Why are we tired after we eat? Because our body uses up a lot of energy to digest the food. That's why they have this, what we call a post-meal coma, right? You realize after a meal, you feel like sleeping. It's because a lot of blood flows to your intestine to digest the food. Yeah. So if you want to exercise with full strength, you should go in with an empty stomach, and your body will know how to gather the energy from elsewhere, especially from your belly, to basically provide you with the energy. Think about it in the other manner. If what everybody says is correct, oh, I must have energy, I must eat, then only I got energy to exercise. Do you know that human would have extinct by now? Do you know why I say so? Think about our ancestors. They used to hunt, right? Can you imagine they are hungry now? They're supposed to go and hunt. They got no food and they die. So when they want to go and hunt, even when they are hungry, they have the maximum amount of energy, because that's how God protects us. This is, we have a very clever body. We have enough reserve to last. Yeah, so always remember, you want your exercise to be effective, go with an empty stomach.
I'll try that. I will try that on Monday. Let me see if that works. If I can't lift, I'll put the comment to you.
Yeah. And by the way, a word of caution, some of you might want to start skipping breakfast, right? Please don't do that if you have gastric. I don't want to be responsible for you, especially if you have gastric. Don't simply skip your breakfast. Please don't do that. Yeah, you need to be monitored by a doctor for that. Okay. If you don't have gastric, feel free to try skipping breakfast. Okay.
Thank you, sir. Thank you.
Any other questions? Otherwise, we can call it a day. I don't see any other hand. Line Kishore Verma, can we hear us?
Hello. Yeah.
Yeah. Go ahead. Let's hear from our MD DC Diabetes from MD 321.
Yeah, it was a very nice session, and many of our myths were exploded. And I'm a diabetic for the last 6 years, and I wish to implement. But again, the same thing: how to do it?
How
Right?
to do
Yes.
it? You need a doctor's monitoring, very close monitoring. I'm so sorry. Many of you are asking me how to do it. I can't tell. You know why? Because everyone is different. Can you imagine? I'm pretty sure if there are 10 diabetics here, all 10 diabetics will be taking different medication. Some will be only 1 year diabetes, some already 20 years diabetes. Some may be on insulin, some not on insulin, some on 4 medications, some on 2 medications, some are overweight, some are underweight. How can the diet be the same? It will be different. How can the fasting plan be the same? It will be different. Everyone is different. So this diet plan is just like medication. Medication is customized, right? Not everyone take the same medication. The diet plan has to be customized. The general concept is the same. But when it comes to one-on-one, right? When we want to really remove your medication, it has to be a one-on-one consultation, because I have to know exactly what is happening to you. Do you have a stroke before? Do you have a heart attack before? Are you on blood thinners? Are you suffering from gastric? I just mentioned not everyone can do fasting immediately, especially if you have gastric. And if you're on blood thinner, you're on a very high risk of bleeding from your stomach. You also cannot do fasting. So what do you do when you can't do fasting? How do you reverse your diabetes? It's a different story altogether. Yeah. So I hope you understand why I can't share openly just like this. Even let's say if you request me to share how to reverse diabetes, if I share, I will put you in trouble rather than helping you, especially if you are going to try to do it yourself. It's very dangerous. I already have patients who gone into ICU because of this, because their sugar dropped below 4, because their own doctors. Okay, how many of you agree? If you start to do the correct method that I share, let's say you got hold of the correct method, you go back to your doctors. Do you think your doctors will switch off your medicine for you, or you will get scolding from your doctors? Do you think if your doctor will off, please comment the word off. If you say no, you will get scolding. Please comment the word scold, SCOLD, in the chat box. What do you think your doctors will do to you when you go back to your doctor? Yes, you will get scolding, because reversing diabetes is something very new. Most doctors hate to reverse your diabetes. They don't want you to reverse your diabetes, because there's a very sad myth that I want to share with everyone. For a medical doctor, a patient cured is a customer loss. Think about what I just said. For a doctor, a patient cured is a customer loss. Think about diabetes. Do you know diabetes has got huge economic impact? Think about it. No matter how much I charge in USD or whatever for my patients to reverse diabetes, it will never be more expensive than the patient taking medicine for the rest of their life. How many of you agree with what I just said? If you agree, please comment agree. You know that the medication will always cost more than reversing your condition. It will always be cheaper than to reverse. It will never be more expensive. And doctors, they don't want it. Because number one, most doctors, they don't even have this knowledge to begin with. Most doctors, they only know how to prescribe. But that's not what the patient wants. The patient wants to get rid of the medication. I believe most of you here do. Okay.
Let's take 2 more questions and we should be done. We have line Baba Yami. Please, you can ask your question now. You can unmute yourself.
Hello.
Yeah.
Hi,
go ahead.
Baba.
Yeah. Thanks for the beautiful presentation. I really learned a lot of things with all what you've just said. When you say we should skip breakfast, that if you can skip breakfast, that you take your breakfast around 11, 12. So it means what you are trying to say is that you eat twice a day, maybe in the around 12, 1, then later in the day. So how soon will you eat your dinner? That's the question I want to ask, because some people say if you want to eat your dinner, you eat between 6, 7. Some will tell you that you don't eat anything after 8 or 9, 10. So how soon will you eat your dinner? Thank you. That's my question.
Okay. By the way, if you are on medications, insulin or supplements, please don't implement what I'm about to share after this. Okay?
Okay.
Intermittent fasting, these 2 words, okay, you can Google online. The most basic form of intermittent fasting is 16-8. 16-8. What does it mean? 16 hours of fasting, 8 hours of eating. The eating window is usually set between 11 a.m. to 7 p.m. or 12 noon to 8 p.m. That means you have the 8 hours eating window where you get to eat. But why I say if you are taking medication, please don't do it. Because most people who take diabetic medication, their dosage is twice a day. Means you need to take the medication every 12 hourly. So you notice there's already a disparity between the two. One is a 12 hours, the other one, the other model is a 16 hours model. So you can't do it if you are on medication. You need to be monitored by a doctor before you start fasting. Okay. So, but for those of you who are not on medication, for those of you who have a belly, you want to prevent diabetes, try doing this thing called 16-8. You start your breakfast, not breakfast, it's called lunch already. You can start your lunch at about 11 a.m. in the morning or 12 noon. And then you take your dinner, the next meal at about 6, 7 p.m. And you wrap up your meal by 8 p.m. latest. So you have that 8 hours eating window. During fasting time, you are allowed to take water, black coffee, and black tea without anything inside. Okay, so this is the kind of plan that I share with my patients. Actually, I'm giving you free information right now because I charge a lot for my consultation actually. Yeah, you know, all these don't come free. Yeah, these are considered free information at this point of time. Yeah, but I'm giving a warning because this is important. If you try doing it and you are on medication, you will end up paying even more to your doctors because you will end up in the ICU.
We have last question from DC Diabetes 306C1. Subhashi, line Subhashi, please.
Yes, thank you very much, Vinod, for giving me the chance to ask the question. Actually, Dr. Andrew talked about intermittent fasting, and he talked about the eating window of 8 hours. So, can we have an idea about the window? Can we have any kind of food, or what is the frequency of having food? Just a brief account about the food varieties.
You know what? It's really tough for me to give a brief account because everyone is different. Remember, I just mentioned everyone is different.
Yes.
You don't know what is your need. You see, for me, I eat everything I want. I can eat all the sugar I want. I take all the ice creams I want. I love all the prata, everything. I went to India, I wallop everything. I eat everything. I eat rice but if you are a diabetic, you're on and you want to reverse your condition, you shouldn't be touching carbohydrates. And that is a long list of carbohydrates, and everyone is different. If I start sharing this, it will take another 1 to 2 hours. Yeah. But as I mentioned, if the information is free, it's even worse because it will cause trouble to you. Because you have to remember, if you stop putting sugar in your mouth and you are still on medication, all right, you will actually go into coma. Your blood pressure will crash, your blood sugar will crash.
Thank you. Thank you, Dr. Andrew. I meant about the pre-diabetic, not the diabetic, pre-diabetic state.
Yeah, it's the same. Shuba, you are on medication, right? You're on hypertensive medication.
No, not me actually. But yes, for the pre-diabetics, somewhat obese people.
Yeah, so it has to be customized.
Okay, thank you.
Yeah. If you want me to put into simpler words, it's 2 words: cut sugar.
Yes.
You have to cut sugar, that means you have to cut carbohydrates. Okay? Sounds easy on paper, right? Try doing it and you will know how tough it is. Because sugar addiction is the worst addiction in the world. Almost everyone is addicted to sugar. You ask any smokers out there, is cigarette good? They will tell you no, cigarette is bad. Can you stop smoking? They will say no, I can't stop smoking. I love my cigarettes. The same goes to all of us here. Even if you know how bad sugar is, how bad carbohydrate is, how bad is the rice that you're eating, how bad is the oats, how bad is the bread, the noodle, the pasta, and everything you're eating. You want to cut? No, you can't. Because it's an addiction. Okay? The next worst addiction that you're seeing, actually not next, now, what you're seeing now, sugar addiction is the worst addiction.
Yeah, that's 100% correct. Like last time the speaker mentioned about a can of Coke has 10 spoons of sugar in it, and people love drinking Coke and sodas, so that's true, 100%. So this has been a wonderful session, and we are already half past more than what we are supposed to do, and it was pretty interesting. So let's hope we can have more sessions from Dr. Andrew. We'll schedule something later. If we can ask questions during that session. So thank you, Dr. Andrew, and thank you all for having joined this program, and we'll see you soon. And also we have released the quiz number 2, that is reversing diabetes, on the site. I will share the link. It's the same link. If you go to the quiz module now, you will find the second quiz coming up for reverse diabetes. So thank you.